Hi, to continue further, what I want to talk about related to cerebral stroke or even ischemic attack, which causes cell death either in our brains or in our heart or both. At that time, when that symptom is developing in someone's body, it doesn't develop the day you die or the minute you died because of cell death in your heart or cell death in your brains. Your death happens because slowly that cell death parameter is developing in your body over a period of time. So some of the patients who might have died from and got diagnosed with a death related to cerebral stroke, that person who is manifesting cerebral stroke in the body, the B fast symptoms that I mentioned below above in the previous video, and I'll include here as well, those symptoms develop in a person's body can develop slowly over time. So the day, like say today I am at a risk of a heavy cerebral attack, today I might show all of those symptoms. But if that symptom has been developing in my body, it's not just today that these symptoms will show up in my health. The day I'm dying or the day I am more closer to severe hospitalization is the day when all symptoms will show up. But 1 year back, 2 year back, 4 year back, if you trace all my videos that I've made in the recent few years, some of the mini symptoms of some health harm happening in my body related to whatever factors that are influencing that health harm is actually showing up in my data, which is all my subjective evidence of what was going wrong with my health over a period of time. And so in that period of time, if this patient, like I mentioned only a recent history of 2-3 days of this patient, that could have likely led to his diagnosis was that he had cardiac arrest. But if you look at the video, he just simply collapsed. People who were trying to even hold him couldn't even hold his hand muscles, feet muscles, completely collapsed. So that complete collapse of his muscles that has happened indicates to me that he likely didn't simply have a heart attack, he also had a cerebral stroke, because it is our central nervous system that determines our body's key functions. And there's a reason why globally earlier, when a person used to have heart attack and their heart has died, that time earlier just heart death was considered as death. But later on, medical professionals changed the criteria of death towards brain death, because some person who had a heart attack, and because heart does govern many of the functions of our body, yes, you can die because of a heart attack. But if your brain dies, that is when you are completely certified as dead in many countries. Why? Because if your heart has stopped functioning, if because we have done so many liver transplant, heart transplant, and other transplantation related things in life, nowadays a person whose heart has died could still be stabilized a little bit for a few hours while a replacement heart can be found for them, and then they could be given a replacement heart and they could still survive through that incidents where their heart had stopped functioning, when their brains were still actively functioning at a normal level at that time. But if a patient doesn't have active brain functions at that time, you can't give them a new heart to make them alive again, or you can't give them all the other electrolytes and whatever can be given to stimulate a person to continue functioning as if they have a normal heart while a replacement heart is found. At that time, whatever, I don't know what steps are done because I'm not a surgeon, so I don't know the details of what is done to keep a person alive while their brain is alive but their heart is dead. But it is possible. If you watched Grey's Anatomy, you might have seen in that series about this. If you are from the medical professional, in some aspects you might have known about something related to brain dead person or heart dead person, right? Some brief information, some of us, most of us might have. So he actually, the way he collapsed, I felt is a cerebral stroke because his CNS functions completely stopped. So he likely had not simply while their ECG machines showed that his heart is not functioning, or whatever else they did to diagnose that he died of a cardiac arrest. It is true his heart stopped functioning, but it is also possibly true that his brain and heart both might have stopped functioning at the same time or nearly around the same time. And because when brain function stops, and that is why cerebral stroke has these sensory related symptoms that it shows up in our body previous to us getting a stroke. Because what does our brain control? A brain is capable of sending us nervous system impulses to our skin and from our skin to the brain. So if I get pricked by a pin and I have a good central nervous system function, that prick by a pin will be felt by me, and that nervous system information exchange will travel via my central nervous system by the nervous system tissues to the brain, and then brain will give us the information that feel the pain. But when someone is having brain problems, when some cells of their brain are dying, when adequate nutrition or oxygen supply is reducing in our brain, like the day you die of a cerebral stroke or a heart attack is a day when multiple cells in your heart and brains are not getting oxygen, not getting adequate blood supply. But before that day, if there is slowly condition developing in my body where every day slowly one or two cells are dying, or one pocket of my brain cells are dying, at that time that pocket of brain cells that were dying is going to cause you a symptom. And that is the symptom. If the pocket of brain cells are the cells which are supposed to communicate with my facial muscles, that is when abnormality, facial paralysis might happen, numbness might happen while I'm smiling, a lopsided smile might happen, or while I am if it is something that is communicating with my arms, at that time arm related functional disability will happen. If it is something that is communicating with my speech center, then speech related disruption, slurred speech, blurred speech, difficulty in speech. And speech is not simply me speaking, right? Speech is also me hearing and thinking and then processing the information and then saying. So if you look at the details of the symptoms that a person with cerebral stroke might be going through, they will also have hearing problems, understanding problems, speaking problems. So if someone, and I have had family members who are actually showing developing symptoms of stroke, but even though they are showing developing symptoms of stroke, because they don't understand their symptoms, they're not ready to say those symptoms to the doctor. Or even if they narrate some of their symptoms to the doctor, if the doctor doesn't correlate what is going on, again their symptoms get ignored. So I have a family member who is experiencing, in the list of 15 symptoms that I referenced in the previous video also, in there some of the symptoms are related to headache, but it is not simple normal migraine headache. It's a very different kind of a headache, or it might be very similar to your migraine headaches too, but other than a migraine headache, you will have some slightly different kind of a headache when your brain cells in your when the cells of your brain are getting impacted. Or when multiple blood vessel flow is getting blocked, what is happening is there is no relief of the normal fluid exchange, normal exchanges that should be occurring in your body. So when that fluid imbalance is there, you will get headache. But do you only get headache? No, you can become cranky, you can become irritable, because again, when water is not there, right water supply is not going to your different cells. It's not simply about water, it is about water, essential nutrients and oxygen. All these three are required by our bodies, any cell, to function healthily. So when water pollution is there, water contamination is there, that will also impact your headaches, will also impact your capacity to speak, will also impact your brain functions. When oxygen supply is missing, that will also do it. When nutritional supply is missing, that will also do it. When all three are missing, that will also lead to cell death, and it can happen either in brain, or it can also be simultaneously while happening in the brain, also be happening in your heart, also be occurring to other cells of your body. And initially the one who is dying of us, our brain does have the skull that protects our head from absorbing too many toxic nutrients from our environment. So in my previous video, when I said about shampoos, initially if I am absorbing the shampoo, and it is who is more likely to get a headache from just simply directly using a shampoo, because I have had that problem. Simply using a shampoo, simply using a product that is giving me a headache. Why does it happen to me? I have had some accidents in my life, like little accident prone kind of a personality, so I could possibly have micro fractures in my skull, which could be leading to some absorption of the chemicals sooner than in a normal person who has a healthy skull. So if two people in the family are using a shampoo, one person is saying it's giving me a headache, other person is saying they don't get anything after using it, or maybe their headache is not happening immediately, but after a few hours they get milder headaches. Why? The one whose skull is properly functioning, whose blood supply is properly functioning, their body, or whose CNS and circulatory system function, every function is relatively healthy. For that person, the shampoo products that have been absorbing by my skin, getting absorbed by my skin, will get absorbed first. It will enter my circulatory system. From the circulatory system, whether it will enter my brain will be dependent on multiple factors. If it does indeed end up entering the brain via the circulatory system's different biochemical processes and functions, if you're healthy, it might take you 8-10 hours to see some symptom, and that too if most of it doesn't get absorbed into your brains, because our brain's functioning is also kept in such a way, there's a blood brain barrier. So anything in your blood should not technically enter your brain unless it is able to cross the blood brain barrier. So if the product is not able to cross the blood brain barrier in your body, you may get only microscopic amounts of it. So you may not only get a delayed headache, you might also get a headache which is only very minor level headache. Whereas for a person who is maybe having some health issue, where either they are going through osteoporosis, or they had an accident and they have undetected but they do have some micro fractures, or their body's toxicity level is now so high that everything in their body can now cross the blood brain barrier because of the pressure only, because whatever barriers are created in our body, they are all very porous membranous barrier, like how you have filters in air filter or filters in a reverse osmosis filter, whatever filtration devices are there, our filtration device of the blood brain barrier is a porous barrier. So if I have minor level toxins or the manageable level toxins, it will not cross the blood brain barrier, so from my blood the toxin will not go to my brain. But if I have too many toxins in my body, there will be a pressure developed now in my body to cross this blood brain barrier, and that's why also a person who's getting that immediate response means that they have likely either some skull related problems going on, or some bone density related problems going on, or some circulatory system problems of high toxicity going on, or they could have a combination of all of these problems going on, such that immediate response is happening to them whenever they are using something that is causing them a headache, that is giving them some health issue. Does that make sense? So because all these distinctions are very necessary, and these distinctions are necessary to understand the patient specific condition. In ideal life, all patients will show same symptom, but when all patients will show the same symptom, when every condition related to that health issue or health harm is same, but every one of us is individual specific symptoms are going to develop in every one of us. In my family history, because I said family history is important in my previous videos, additional info, know this: when you are analyzing the patient and want to accurately diagnose a patient, in the PharmD Doctorate of Pharmacy course, we've been taught that subjective information, objective information, patient history and patient family history, all are important aspects of knowing how their health, of understanding and getting a better assessment of the patient's health. And in actually family history, now people should also start including social history or work history of a patient as well, which I don't know whether it's been done, but work and social history are also equally important, and which is what I narrated in the previous video of his potential work history, potential because of the work he does, because of the place he lives, because of the cultural history of his of the people of that region. All that I included because that shows some elements of family history, some elements of personal patient history, because if you're working in retail you can become efficiency oriented. That's why also, or if you're a man who has got short number of hours to go and attend something, that's why also people can have this let's do a quick visit to a cousin for a wedding and come back. And many Indians do that. Most Indians also are typically even if you're a man or a woman, many men or women in India, when they want to attend their friend's wedding, family's wedding, do this. They'll go immediately and come back and do a short trip. But in that short trip, when you're doing that short trip to increase the efficiency of your life, if you compromise while you're doing the efficiency, that is possible when you are in a fittest state of health. Doing this quickly efficient paradigm that he likely followed was would have worked for him, but he was not in his optimum state of health and he didn't know that. He might have had, if he indeed had a cerebral stroke, I don't know if his body has been post already, because his body could have been released already, but his signs of cerebral stroke could be also present in the rest of the video of the wedding as well, because it's an Indian wedding. So in an Indian wedding, videographers videograph things from multiple angles, or people are taking nowadays selfie cameras and videos of events. So his death related past history could have shown up in the few hours or few minutes he attended that wedding. So if he was there for 1 hour, 1.5 hour, that data is there. If while traveling also in the airport videos also, some of the data related to what was going on with his health history might have shown up. If he had mindful parents or someone who was a mindful co-worker, even those co-workers or parents could have realized that he was showing some symptoms related to his heart attack. And that is important because if you correlate the factors related to someone's death accurately, while you couldn't prevent this person's death, someone else in his same family, their death could be prevented, their severe hospitalization could be prevented. Other people who are doing similar work like him, living in similar conditions like him, their death and their health harm can be prevented. And in my family history, there were two families who died of actually cerebral stroke. Now, one person who died of cerebral stroke died immediately. So their conditions were such, again, whatever was going on with their health, whatever harmed their health, immediately caused cell death while they were sleeping. And by the time someone detected that they are having a stroke and took them to the hospital, despite some medical interventions, they stayed alive for a few days, but they eventually passed away. Whereas the other person who was living in the same house, doing many same activities as them, had the same lifestyle choice, lifestyle conditions, but the nutritional things were different, because one was a man, other was a woman. One was a taller, fatter man, another was a thinner, shorter woman. So all these factors also influence, that is called patient subjective evidence. So a patient's height, a patient's weight, a patient's physical nutritional condition, a patient's exposure to a chemical, all of it determines how good or bad their health will be. So for the person who died, the other person also got cerebral attack, but while they got a cerebral attack, they actually got paralyzed in one side of the body. And this paralysis happened because in their body, while for the other person, entire possibly multiple cell deaths happened in their body as a result of the stroke, and because multiple brain functions stopped, they eventually died, right? And not just brain function, but I don't know what the details were when they were in a hospital. If someone gives them their medical data to me, I can interpret it based on my level of expertise about it, but it will take me a time to interpret and to say whether it was a brain death, whether it was brain plus heart failure, whether it was brain plus heart plus liver plus other organ failure. Because as I said, what was developing in their body was developing long before just the day they died. Similarly, but because their brain death was too intense, or their organ damage plus brain damage was too much, that's why they couldn't be saved even after being taken to a hospital. And the other person also was hospitalized and then had to have caretakers at home, but their paralysis continued, because while they were saved, like their cell death caused some death in the brain cells, leading to paralysis now in their body. But it wasn't that extent deep death that they died immediately. So the paralysis continued. They had to get treatment for the paralysis, medications for the fall they had. They also had eventually a fall in the future after the paralysis and stroke. And again, why was the fall happening? Because after you had a cerebral stroke, now while they're getting medications to prevent the stroke from getting worse, so they were getting possibly blood thinners to ensure that they shouldn't have stroke in the future. They were getting medications to ensure that our blood doesn't get blocked, right? So the blockages shouldn't happen. That's why they were getting medications. And the family where this happened is a family of doctors. So they had doctors in the family, people of the medical profession taking care of their medication needs. So they never had access to healthcare related problems. But even though they didn't have access to healthcare related problems, they also were in a average middle class family. So they didn't have direct nutrition problems, but you can still have nutritional deficiencies if your cardiovascular system or circulatory system or any system of your body is malfunctioning. At that time, some nutritional deficiencies and challenges will also show up. And because whatever environmental factors were impacting their brain cells functionality, while the first symptom was they got stroke and they got paralysis as a result of the stroke, the second symptom of the CNS disruption that was happening in the body was what? After a few months or years, they also fell down and broke their bones. Now the bones were broken because again they had been a different size person or having nutritional challenges or deficiencies. They could have had low bone density, all of which led to the fracture. But why did they fall? They fell because likely if that CNS problem causing chemicals in their environment, chemicals in their food, chemicals in their water is not taken away from their daily life, that CNS damage initially might have led to paralysis and stroke that led to paralysis, but it could also be causing now cell death in other parts of the brain that is not related to paralysis. And those other parts of the brain functions that were getting disrupted means that while she is walking, she was getting some assistance for a while with a nanny helping her go to the bathroom just shortly after she was hospitalized. But what is a general trend? If a person is hospitalized for a while, you may keep a nanny for how long? Until the patient regains their motility. And if a patient is very individualistic oriented, the patient can start complaining, I don't need a Aya, why are you giving me a Aya? All these things can also start happening. Whatever it is, until you are completely, when you are dysfunctional, like you need help to have someone take you to the bathroom for a shower, take you to the bathroom for bathroom functions, at that time you will be okay with the Aya. But once you have gained good enough motility, now you are that Aya will be taken away. So most of the time people, for how long do you keep Aya? You keep Aya for 6 months or 1 year or 2 years, depending on whatever the family decides, right? So at that time the Aya might have gone away. So when the Aya is not there, there's no one to observe why she is falling, there's no cameras to observe how she fell, and most patients at that time assumed that she fell in the bathroom, so maybe it was, or in front of the bathroom, their bedroom had a bathroom in attached bathroom. So now you can fall, have a slip in a bathroom because of the slime in the bathroom. You can slip and fall because of simply your slippers, like how I mentioned in the previous video. If the slipper, because we used to wear slippers also in our homes, so the slippers could be slippery, or your feet imbalance could also be there. This feet imbalance I didn't mention in the first video, but when you are going to the bathroom, entering the bathroom, sometimes you depending on what is your family culture's practice, some people enter the bathroom wearing slippers, and some people enter the bathroom without slippers. You keep the slippers outside the bathroom and you enter it with your own feet. So whatever you're doing, some parts of the, sometimes when you're slipping, it could be the shoes that are slippery, but when your foot is slipping on the ground somewhere, and while doing a normal activity you suddenly slip and fall, now that tumble and fall that is happening, depending on how that tumble and fall happened, it can indicate that you are having some CNS problems, because when central nervous system's functions are disrupted, you will also end up falling abnormally. And I will try to find those videos of those children and actors that I'm talking about, whom I have seen fall like this, where I felt they are having some more deeper issues than simply someone slipping and falling. So I feel for my grandparent, this was the incidences that I've given were 2 grandparents. Now for the second grandparent who survived through the cerebral stroke, all these other CNS symptoms kept showing, because cell death was continuously happening, and we can't take a cross section of your brains to know whether cell death is happening. But then how do you decide cell death is happening? Via all these symptoms and how the symptoms are manifesting. Because if and when I said that how why is in my previous notes I have written that it is very important for the doctor or someone who is hearing your medical report to understand your medical information appropriately. That importance is necessary, because if someone says this person stumbled and fell, or they just fell in the bathroom, and if you just assume they fell in the bathroom because it was a slip, like most of us know, many of us have possibly fallen in the bathroom in the past, right? In the bathroom, near the bathroom, around the bathroom, wherever water is there, many of us have slipped and fallen. So most assume it's because of the water, because of the sliminess of the bathroom, that we might have fallen. But that is the typical assumption, but you can't make that assumption. That's why you need patient history. So if you just record that they slipped and fell in the bathroom, you will just decide that they slipped and fell because they were accident prone, or they had an accident, and you will just give them medicine related to their accident. But now if you correlate that this patient who fell in the bathroom also a month or few months back or few years back had a cerebral attack, also that cerebral attack had caused them to have paralysis, meaning they had CNS disruption, then that fall and how you fell, you should ask then deeper questions about how you fell. Now these deeper questions are usually not asked by the doctors, which is necessary now for doctors to ask a patient, because if you don't ask these deeper questions, you will never get the answer. And if you don't ask, don't think that these deeper questions are relevant, don't think that 2 years back incidence is relevant to today's incidence of fall, then you miss giving them the right therapy. Because the right therapy shouldn't have been simply that they get their bone fracture fixed, or but the right therapy also had to include the fact that there is something in their environment that is likely causing CNS disruption, blood flow disruption, leading to like a blood flow problem, which is leading to cells in our brains dying, which is then leading to a CNS disruption, which is then leading you to tumble and fall unexpectedly. Right? All these correlation you can make when you understand the situation or what is going on with the patient deeper, when you actually take the time to diagnose a patient deeper. Because this deep analysis was not done, no one has yet done in my family this analysis, that most of the people who have died while they got medications for the immediate health problem they were going through, the real resolution, if they really had to live through the paralysis phase, her paralysis also didn't go away. What does that mean? When her paralysis, it did heal a little bit. And again, I do not know all the details of this grandparent. At that time I was living in US, and I hadn't come to India to visit her. By the time I decided to come to visit her, she had already passed away. So there were 3-4 years that I didn't watch her, observe her, or how I am observing all these minute details of other people in other videos. That kind of thing I haven't done with her, because I wasn't there in her life. So because I wasn't there in her life, I wasn't communicating. I was also having some personal problems. I was hardly communicating with many family. So at that time, whatever I am narrating about her health incidences is second hand information. But despite it being second hand information, in that second hand information also, I do know, I've lived in that house, so I do know how the bathroom is. I have lived in that house, so I also know what are the chemicals in their environment that could be possibly harming someone in their health, right? So I have lived in that area, I've lived in that house. I know the house specific conditions, locality specific conditions, local food available specific conditions, local things used by the family related conditions, all of which the chemicals that I'm talking about that are present in our food, water, clothing, air, all of which are impacting or were responsible for impacting her overall quality of health. Not just her, it is impacting her husbands, everyone else who lived in that home, but in different people because of their different activity level, food consumption level, lifestyle choice practice. The symptoms would manifest slightly differently in different people depending on what they do more, what was practiced more. And not simply that, her past history is also very important. There's a reason, and because of her past health history, she was a thin, wiry, short woman versus her husband who was a tall, fat, chubby man. So one had more fat in their body, one had less fat in the body, one had poor bone density, possibly because they might have had nutritional deficiencies in the family they were raised in. Other had more healthy food in their history, so because more healthy food was consumed by them, they had a higher bone density, right? So all these factors also end up impacting eventually your health. But this other person who died immediately of stroke, they also had a fall in the past, and in that fall, while the detectable fall was led to their hip fracture, there was possibly other micro fractures that could have happened as well in their body, and that could have also led to their absorption of the chemicals in their environment sooner if it was a chemical from water, chemical from the detergents that are getting used, chemicals from other things in their home environment. All of it again could have impacted their brains sooner if they had undetectable microfractures, or again the blood-brain barrier thing that I'm talking about, because they also had other history, health history that could have, I don't know their deeper health history. Again, I need to look at, if someone gives me the chart of the health history, I can look into it. But they could have had blood pressure problems, they could have had other health problems which were indicative of the fact that things were toxing out in their blood over time, and that's why their stroke led to immediate lot of CNS death, leading to their overall death possibly. And not just CNS, if depending on the reports now, you could detect whether it was just CNS, whether it was CNS plus heart malfunction, CNS plus liver plus heart plus kidney malfunction. All these combined could have led to their eventual death. So I hope this made sense, and if people have any questions or comments or want to discuss these topics, please drop a question, comment, and open up the discussion on this. This awareness is necessary in India, because if I go to the doctor with, even if I know BFAST symptoms, and I go to the hospital, I knew I didn't have BFAST symptoms, I was having cardiovascular symptoms, and I knew many of my symptoms were correlating with some cardiovascular distress. So I went to the doctor with my cardiovascular symptoms. But if the doctor doesn't do the deeper subjective objective analysis, doesn't correlate the patient past history, present history accurately, doesn't understand the deeper implications of the history, I don't blame it. I went to the doctor only one time, maybe 2 or 3 times. If I go, they might ask me more deeper questions about my patient history. But even in the day I went to a cardiologist with the right information, in that information that I took to that cardiologist, I had a lot of factors in my blood report that were showing that my circulatory system function was disrupted. And this is very important for cardiologists nowadays to understand, or anyone who is a neurologist, for them to understand as well, that if your blood reports are showing that your circulatory system is disrupted, it is very likely that that circulatory system's disruption is slowly also one of the factors impacting someone's cardiac function, impacting someone's neurological, CNS or other brain functions, because everything in our body is interconnected. So this is one thing the doctors need to wake up to, who aren't woken up to this fact. Secondly, they did a stress test, because they did, it's not that they completely ignored what I said. They did believe some of it, and they believed my past patient history, that both my parents had cardiac incidences in the past. One died of heart attack, one had angioplasty, angiography. I again don't know the details, but they had a heart surgery, they had heart blockages, and they had heart surgery. So both parents had cardiac health history. So he believed it, and that's why he did a stress test. He asked me to do a stress test. Now, while doing the stress test, the technician who was recording the stress test, now the technician could see I was in distress while I am running. So while the stress test has, I think, 5 or 6 levels you have to do, she stopped at a beginner. She didn't do all the levels. I don't know how many levels are there in a stress test. I've forgotten, or I've never paid attention to it. So I don't know this. But all I know is she herself said that I'm not doing the future levels because you're showing this distress. Now, while she understood that I am getting in heavy distress while doing a stress test, which by itself indicates that some cardiac distress is going on, that should be a pertinent, relevant information fed into my reports. But that pertinent, relevant information was not recorded, because only a technician was doing the stress test. And when the doctor looked at the reports, stress reports, in the stress reports there are some anomalies also showing up in my report, but he assumed this is an anomaly all women have, or some section of women seem to have this anomaly. He has studied that. I also looked it up, and at that time when I looked it up, I also saw that that anomaly is common in some population of women. But here again the due diligence hasn't happened. Yes, maybe some population, let's say 30% of women or 20% of women, have the same anomaly or abnormality that my report is showing. But is that abnormality, now if that is all the information you have and you've not dug into it further to know, is that the abnormality that can increase your incidence of heart attack? It is possible it can increase someone's heart attack incidences. It is an abnormality which can disrupt someone's normal cardiovascular function. So that abnormality, if you ignore just by thinking that certain patient population have it, but don't do the deeper diving of if a certain patient population has this anomaly or abnormality, what kind of different therapy has to be done related to that abnormality, then again you are not doing complete a therapy of the patient in the right way. And when I went to the doctor with the stress report, I told the doctor that even if he ignores that anomaly, and I researched that abnormality later on only, but if he just looks at the report, and in the report the graph is looking all normal, and he assumes that's why I have good health, then he is completely ignoring my subjective evidence that I do not have good health. I was having a repeated bad health phase for many months before I went to a cardiologist, and not just repeated bad health phase. My functional ability to do normal cardiac functions had gone down greatly, like massively down from what I used to do. Like in US, I could work out in a gym for 1.5 to 2 hours a day for 5-6 years I have done it like a 5 to 6 days of daily practice in my normal life. So there was that long a stretch of year when daily I was doing 1.5 to 2 hours of cardiac exercises. In India also I have joined gym and done that for a few months. In India I have also gone to the gym and worked out in a gym for 1.5 hour. I used to go for 1.5 hour long walks in India. But from that long hours of walk, long hours of gym activity, when I'm not even able to walk for 10 minutes without having a high intense heart rate, that is a function you have to examine. You have to do the deep diving of looking at a patient as to why are they suddenly having this abnormal heart rate and decrease in heart functions. And if they had done the deep diving, if they had ordered the right test, then only I can, if the test was that pesticides have accumulated in my body, and that's why I'm getting this cardiac anomaly or other chemicals in my body, some poisoning is happening. I can't get that report from a doctor who is ignoring only the symptoms that I'm already showing up with. And not just ignoring the symptoms, when I'm giving him a check that you should discuss it. I asked him, can you discuss it with your technician? That the technician didn't, and the technician made the right call. Let's say my heart is at a failure level. If they push me to do a test, and what if I get a cardiac failure right there while taking that test? That's why that technician was cautious and didn't let me take the later stages of the test. So that itself, a patient who is not even able to do the later stages of a test itself should be a red flag. The patient who is while doing the test also, while the heart activity is looking well, but overall the health status, like how I said with Rima Laghu, I could see that she was having breathing distress. That breathing distress that she was showing in the series way before her death, at that time those breathing distress like symptoms were happening with me as well. So that is important subjective evidence of a patient who is near heart attack levels, or near heart blockage levels, or near cardiovascular circulatory system or some other organ malfunction levels. And the symptoms of not only my circulatory system being disrupted was there, my liver being disrupted was also there, both of which then again is capable of impacting your heart health. So my heart health was not simply being impacted by my cardiovascular problems or circulatory system problem, or just cholesterol being high in my body. I had just 1 point or 2 points extra total cholesterol. My other cholesterol parameters were not high. So my total cholesterol being 1 point high is ignorable. So it's not the cholesterol that was causing me cardiac problems. It was other factors that were causing me cardiac problems. But a base level doctor will only look at cholesterol or only look at a diagnostic report and not do the deep diving of the diagnostic report or the medical data that is there, both in the subjective evidence of what the patient is saying, in the patient history also. And my patient history, when I said you have to also now start including social history and other history. The social history is this, that what I was very much capable of actively doing 5 years or 10 years before I met this doctor. And in the 5 years, while some activity levels had gone down, it had not gone down to a dysfunctional level, but shortly before I saw him, it had gone down to completely dysfunctional level. And there's multiple other reasons I needed a report from this doctor, because my health problems were not simply from what I have discussed so far in all these videos. There's some other thing also that was going on, but I can't go and mess up the data collection related to that information. That's why I can't reveal that data at all. These are all already known data, already known things that impact a person's health in a normal human who lives in the same city as me, who lives in the same house as me, who lives in the same socioeconomic status as me. All these things that I have discussed in all these videos are normal. Or even if there's someone like me who has lived partly in a Asian country and partly in a developed country, they also will have some of these similar incidences that I am discussing in these videos. So there is a population group who's having similar health experiences like me. But there is one additional thing, and that additional thing, I can't get the right diagnosis, analysis, right help related to that thing if the doctor first doesn't address all the normal things related to disruption of my cardiac health or disruption of my CNS health, health, then only they can get that additional information. It's like everything has a layer to it. Like if you are studying in school until you cross 12th standard, you can't be eligible for doing college level work. Until you do college level work, you can't be eligible for doing masters or doctorate level work. Why? Because there is a reason why you have to do first until 12th, and in India after 12th you do college, meaning a bachelor's, and after bachelor's you do masters, after masters you do doctorate. There is this step by step gradual upgrade of information that your brain is ready to take. Your processing capacity develops over time. But a doctor whose processing capacity hasn't gone beyond understanding that cholesterol is not the only problem that impacts cardiac health, can that doctor treat a patient with 5 different other reasons of their cardiac problem? No. If the doctor now understands that cardiac health can be impacted by cardiovascular system and circulatory system and liver functions, then the doctor has done a little has gone from one level of practicing doctory to a little evolved level. But if they again get stuck in these 3 things, then they are not doing the due diligence that I need related to other things related to my life, that I can't go towards until I find a doctor who is at least able to understand these 3 parameters at least, or the multiple parameters at least that I'm discussing in all these videos. Does that make sense? Otherwise, and that's why only I'm doing the opposite kind of therapy of preventative care, where instead of taking, because if my body is already toxed out with multiple chemicals, if I add one more chemical, because a drug is a additional chemical, and this is what in PharmD also I am learning, or I was learning when I was doing that course, that if there are in elderly patients, this data has been studied more effectively in US, that if a patient has now taken a drug also for 10 years and has 2-3 health conditions where they're taking, let's say, 10 drugs. Now those 10 medications that they are taking over time of their health history, even if in their 60s or 50s that medication was beneficial to them, if at a certain point of time in their 70s or 80s that medication that they used to take in the past is causing some side effect, is causing some drug interaction, is causing some health incidences associated with that medicine that has already been tracked in medical or pharmacy data, then at that time you have to stop that medication, reduce the dosage of the medication, change the medication into something else, right? So there are patients in the polypharmacy related topics, in the patient therapy management related topics, where we are taught to ensure that if a patient is taking 10 drugs and used to taking that 10 drugs for 10 years of their life, it is possible, or maybe not even 10 years, 30-40 years of their life, they could have been taking many of these drugs. But there is a time when a drug that they have taken for 40 years, they might have to stop taking. A drug they have taken for 10 years, they might have to adjust the dose. A drug, if 10 drugs are there, out of 10, maybe right now, given the health status of the patient, they can't be given all 10 drugs, they have to be only given 6 or 7 drugs. So reduction in drugs, reduction in chemical content in their bodies, impact in their body, is what is being done when you do drug therapy management and patient specific therapy management, all these different things that you do when you are a doctorate of pharmacy person. But I am not simply a doctorate of, I didn't even get that degree, but I also have a pharmacology related background. So that additional thing that are happening to me is related to pharmacological impact of chemicals and drugs in my body, and that pharmacological impact of health harm caused by multiple chemicals in my environment, multiple chemicals in my home life, multiple my specific health related conditions, plus the health related conditions of the area I am living in, the areas I have visited, the countries I have lived in, all are factors in determining my overall health history. And that deep diving doctor, if not applicable or available somewhere that I'm going to get treatment from, can I get the right treatment, or will I eventually end up from dying, having a cardiac failure? Like, I know patients who have gone to the doctor to get a good health checkup. Now, like how my ECG ECG report, if let's ignore the fact that I had a abnormality. If I didn't even have the abnormality, that abnormality does play a factor in my cardiac health. But let's say there's another woman who had same incidences like me, she doesn't have that abnormality. But even then, if she's having cardiac distress from multiple reasons, and her cardiac distress while doing the stress test, the technician or whoever was doing the stress test got worried that she will have a heart attack, and that's why they didn't do the heavy level stress test, the ECG report will show that it is all, the map and graph will show normalcy. But the graph showing normalcy doesn't mean she has a normal heart. It just means at the lower level of doing that test, she is still fine. But at a higher level, they didn't even risk asking her to go to a higher level, because she doesn't have the right health status to do that test at a higher level. And also understand, if I have had a health history of many years and decades of gym workout, my heart health is definitely in some ways much better than the heart health of someone who has never worked out, right? So that way my heart health is going to be better. These ECG machines also, when they are recording the heart health of someone, they are assuming that the patient who they will record a heart health of is going to be someone in their 60s or 70s, where many heart functions are failing. Not simply the cell death is occurring, but cell death can be occurring, heart muscles could be failing, blood pressure problems could be existing. That's why the abnormality of the graph occurs in a person who is much older than me. But a person who is my age, be it a man or a woman, may not have that abnormality show up in the graphical representation, but the abnormality is there, not related to the graphical representation. Or my cardiac muscles could be perfectly fine. So if my cardiac muscles are perfectly fine, or if my flow of fluids inside my cardiac organ, that is what it is. The action potential that has been recorded is the exchange of fluid happening in my cardiac cells. So that exchange of fluid that is happening in my cardiac cells, that flow is right. But if I have nutritional deficiency, then also I can have cardiac problems. If I have multiple chemicals blocking my heart, but while the recording is going on, how do I explain this? Like when you are doing overexerting yourself, at that time more blood flow is needed, more flow of blood is needed to show that same graphical representation. But when I'm going and doing the stress test at a higher running level, at a time if my heart is indeed blocked, my blood vessels are blocked, or my cardiac muscles are not functioning in the right way, or cell death is occurring, at a time what will happen? While in a normal sedentary state, the blood flow is happening okay, and the graph and the exchange of minerals and fluids inside my system is happening okay, and that action potential is being shown as a normal action potential. But when I'm running, because cell death is happening at that time, because if I run, I need more oxygen, I need more nutrients, I need more water, all of which is deficient in my body currently. That's why I'm getting cardiac symptoms, and that's why if I run more, I'm getting exhausted more, which is what is a observable subjective factor you have to record about the patient to understand that they are not at good health status. And if I didn't have the cardiac problem, then running at a higher pace wouldn't be causing any symptoms that would scare the technician from giving me a higher level stress test. I hope this made sense. Again, if anyone has any questions or comments, please post a question or comment. I can go on and on about a lot of things, but I'm again getting tired. And this is a issue that you can discuss at a large scale level, much deeper level. I do not even not being a cardiologist. I am only discussing it at a pharmacologist or past pharmacy history and personal patient history level. But a more well-versed person in these factors can actually go and take this at a right level of therapy care needed for a cardiac patient or for multiple cardiac patients globally who need this intervention now. Otherwise, if right teachings are not done, if right levels of interpretation of patient data is not taught to doctors, many patients are going to be suffering like me and might even end up dying of a heart attack someday. Even if they had gone to a doctor, the doctor could have ignored them saying, oh no, your reports are showing okay. But not everything is there in our report. Some things are there beyond our reports, or how you interpret the report is also equally important. Like how the report was recorded, what was happening while the report was recorded, what other factors are indicating apart from just one machine report that other problems are going on with the patient. I hope that made sense. And again, have any questions, comments, please drop a comment. Thank you very much. Have a great day.